while we're on the subject of amendments, actually, Congressman almost-elect Loughlin had asked, from the perspective of somebody who also analyzes the constitutionality of policies, kind of an interesting theory that in a sense, you could look at an excise tax being applied to your failure to purchase health care as being a penalty. The problem is that people are pretty clever, and the other thing you can do is basically write a bill that says everybody pays an excise tax, but we'll abate it if you buy health insurance. So unfortunately, there are ways around, and there's semantics, but to take Rush Limbaugh's phrase, one step further, semantics matters. So I think at least it's good that we have a constitutional discussion. The constitutional discussion that I have noticed the most about this bill, and one that I think has some traction with people, whatever way the court would go on, is actually the 10th Amendment question. And that's whether mandating people to buy insurance is really a power that's contemplated, in terms of the government's power to regulate commerce. Now, you would say, well, forcing people to buy something, that's a regulation of commerce. We could force everybody to buy a car. But as a practical matter, if it's being done for really a police power purpose, a protection of people, it really is that would be customarily a state power. And you may agree or disagree with it. They try to mandate it in Massachusetts. So amongst constitutional scholars, the most serious argument I've heard is that this really oversteps the bounds of federal power.
Does anybody else have any more questions? I think we'll take 2 or 3 more questions, and then we'll hang around. If you want to hear from us individually, then come on up and chat.
The constitutional topic is very interesting. I think we probably can talk about it all night long. What provision in the Constitution is it that you think allows the federal government to do this? Especially, I think, when we're looking at the president telling us this is not a tax. They have to call it a tax. You're right. The excise tax will make you think very tricky, slippery thing to do. If they don't call it a tax. Number 2, the overstepping that they usually use to get their fingers into everything is the interstate commerce provision in the Constitution. Well, we don't have that here. And I'm actually a little concerned about proposing interstate health insurance, because then that gives them the ability to reach in and then do guidelines.
Right. Well, it potentially gives them the power to regulate. In other words, federal regulation, if you had interstate sales, might be preempted, or Congress could pass a law. So while there was a gentleman who was concerned if we have particular mandates in Rhode Island we think are appropriate for particular protections, yeah, it is conceivable when you have a more national market that Congress would enact mandates or would effectively, preempt some state experiments, and that has happened with national markets. So it's something that we should pay attention to. The real question, though, is whether really it's a chicken and egg question. In a sense, regulating the kind of insurance that could be offered, if it was offered across state lines, there might be a federal power to do that. But is the power to regulate commerce the power to make you buy insurance? Right? And and look, I'm not saying, honestly, if you read a lot of the blogs, what they say is unless the next election goes the other way, the Supreme Court is not going to overturn, whether it's might be academically speaking constitutional or not, they're not going to overturn this kind of a program unless, really there's a clear statement from the electorate. In that sense, I look at the Supreme Court as a legislature with just a very long term.
Can we get one more question in tonight, and then we'll be around if anybody wants to come up and talk to us?
And I want to know is Congress going to have the same health insurance
That I think we will rhetorical question.
Ladies and gentlemen, first of all, I want to thank Reese Marks and Terry for a minute, and I'll wrap up and we'll get you on your way. We'll be around here individually, all you want.
John, thank you. Ladies and gentlemen, good evening. My name is Mark Zakaria. I'm from North Kingstown, and I came over here tonight to support John and what he's doing. As you may have heard earlier, I'm running for Congress in the 2nd District, and so, gentleman from Cranston, let's talk later. The thing that I think that you should look at is what's going on here tonight. It is an example of the kind of service that you should all expect from public servants. Where corrections had to be made, but nobody had to throw rocks at anyone else, and you know what? We all come away feeling better. Ladies and gentlemen, that's what you want from your public servants. So you certainly want this guy representing you in the next term in Congress.
Yeah.
And he's made quite a commitment. You, believe me, I know the kinds of things he's going through. You need to make a commitment too. Your commitment needs to be more than just, it's sweat, it's folding and stuffing, it's being a volunteer, it's putting the bite on your neighbors to say, listen, you gotta look at this guy because he's something you should think about. It requires an activist community to put a guy like John Loughlin into Congress because you're up against a tidal wave of special interests that want to keep him up. So if it's really going to be the people talking, let's talk John Loughlin, let's help him out. Thank you.
The most important point here is that we held a town hall meeting. We were civil. We spoke with one another. We had a conversation with experts. We, in some cases, agreed. In other cases, we disagreed. But the most important thing is I don't see any wave of crazies in this room. I don't see anyone that you should be tolerating from in your office in Washington, D.C. and be afraid to speak to. These are your constituents, Congressman. I suggest you come out here and meet them. They're wonderful people.